Hi, folks. My name is Max Bingman. Today, I'll be explaining what pre-addiction is, what the associated symptoms are, and what to do if you witness it around you. So, I guess the real question is, what is pre-addiction? Pre-addiction is actually a relatively new term, but is often characterized as mild or moderate substance use disorder. As the name implies, pre-addiction occurs before addiction sets in. The reason detection and treatment is extremely important for this disorder is because of the effectiveness of treatment. To better explain what pre-addiction is, I'm going to step you through the four steps of addiction, and to help better visualize, I will use alcohol as an example. The first step of pre-addiction is experimentation. This is your first experience with the drug. It is actually highly encouraged by your peers. For example, your first drink of alcohol. It's considered an exciting moment and many times due to peer pressure. Experimentation can then lead to regular use. You're going from trying out alcohol for the first time to drinking maybe Friday and Saturday night every week. Often this behavior is not problematic, but when it crosses the fine line into high risk use, that's where you see a lot of the associated issues. Now, you are no longer drinking Friday and Saturday, but maybe Sunday, Monday, and Tuesday as well. You went from drinking 2 nights a week to 4 or 5. While this is not considered addiction, this is often where we see pre addiction start to set in. When you're drinking that frequently, it starts to impact different aspects of your life, whether it be in your job, personal relationships, or in your interests. This is where pre addiction can turn into full on addiction, which is our fourth and final step. This is constant drug abuse, and you become dependent on the substance to get throughout your day. This is where a lot of horrible consequences start to set in. Now that we know where and when pre-addiction occurs, we need to look for associated symptoms. It's actually believed that pre-addiction occurs anywhere between 2 to 4 substance use disorder symptoms. To name just a few of the symptoms, we have taking substances in any other way than directed by the prescriber. This would be if you got prescription pills and you're either taking it more frequently than directed or administering in a route that was not prescribed. Expressing desire to reduce or stop the substance, but being unable to do so. I see this very frequently in vaping. People say they can quit, but when asked why, they often say, because I don't feel like it. Experiencing uncontrollable cravings and urges to use the substance, giving up on important things in life, such as a career or once loved hobby. Maybe you really enjoyed going out with friends, but now, with the substance use, you no longer enjoy hanging out or even being around other people. Having difficulties in relationships due to substance use and still being able to stop. If you're going out and getting drunk every night of the week, that can be very taxing on your loved ones. Pre-addiction in its varying definitions characterized as 2 to 4 symptoms. 2 is considered a bit more mild, while 3 to 4 is considered moderate substance use disorder. You might be thinking just having 2 of those symptoms isn't too bad. I'm not completely addicted to the drug. Well, you might be right. Your body's not physically dependent. If you leave it untreated, it can have some very serious consequences. Well, what if the symptoms are left untreated and pre addiction goes to full on addiction? Well, as you might have been able to guess, addiction sets in. Your body is fully dependent on the drug. Financial downfall, whether that be you're no longer working or you're spending all your money on your addiction. Relationships issue, which we previously discussed. And if it gets to a point where you can't come back, even death. What's crucial about recognizing pre-addiction is the fact that how effective treatments can be. If you feel someone around you, or even possibly yourself, might be experiencing pre-addiction, depending on the substance misuse, there are many options. There are rehabilitation centers, counseling, lifestyle changes, and for opiate-related issues, medication therapies. If it doesn't seem that pre-addiction is that serious, please keep in mind how quickly it can turn into addiction and how important it is to curtail this behavior early on. I hope you learned a little bit more about pre addiction and can use this information to better change the world around you. Thank you.